The 30th of January, 1933, Germany. Adolf Hitler, the leader of the Nazi Party, is appointed Chancellor of Germany and aims to lead the German master race to victory in the racial struggle against those deemed as inferior peoples, especially the Jews. In shaping and implementing many Nazi policies, the German medical profession plays a central role, and many doctors and nurses become involved in crimes of the regime. While some German physicians welcome the Nazi regime because it supports their beliefs about racial hygiene, others join to take advantage of opportunities to advance their careers. Among them are 200 German doctors who from 1942 begin to conduct painful and often deadly experiments on thousands of concentration camp prisoners without their permission. One such doctor is Horst Schumann. Horst Schumann was born on the 1st of May, 1906 in Halle, then part of the German Empire. When Horst was 5 years old, his parents divorced. After this divorce, Horst remained with his father, who was a doctor, and because his father's second marriage also failed, young Horst was practically raised by his older sister. Nevertheless, Schumann followed in his father's footsteps and decided to study medicine. In 1930, during his university studies, he joined the Nazi Party, and in 1932, he became a member of the Sturmabteilung, also known as the SA, which was the Nazi paramilitary force, also known as the Stormtroopers or the Brown Shirts, for the color of their uniform. On the 30th of January 1933, Adolf Hitler was appointed Chancellor of Germany by President Paul von Hindenburg. In the same year, Schumann received his medical license and began his career as an assistant doctor at the surgery department at Halle University Hospital. In November 1933, he married Frieda Meyer, with whom he had 2 sons and remained married for 10 years. From 1934, Schumann was employed in the public health office in Halle, and in 1939, he was recruited to the Luftwaffe, the German Air Force, as a physician. The Second World War began on the 1st of September 1939 when Germany invaded Poland. In October 1939, Schumann met with Dr. Viktor Brack, who was the head of the Führer Chancellery. During the meeting, they discussed Schumann's involvement in the Nazi euthanasia program, codenamed T4, which was the systematic murder of institutionalized patients with disabilities in Germany. Schumann's first assignment was to set up a killing center for the mentally ill and disabled at the Grafeneck Castle in Württemberg. In January 1940, the first transport of 25 men from a sanatorium and nursing home near Munich arrived at Grafeneck, where they were murdered in the gas chamber. Schumann remained at Grafeneck until the summer of 1940, and during his stay, more than 1,200 patients had been killed by carbon monoxide gas under his supervision. Before being killed, the patients were examined by the hospital doctors, and some of them were given sedative injections. The examination, which lasted from a few seconds to a minute, served to check the factual and personal correctness of the patients brought in. The patients were then sent to the gas chamber, and in the meantime, the doctors operated the manometer that allowed the carbon monoxide gas to flow in. When after around 20 minutes, no more movement was detected in the gas chamber, the gas supply was stopped. Schumann was then transferred to the Sonnenstein killing center, and under his supervision, almost 14,000 patients and over 1,000 concentration camp prisoners were killed in the gas chamber between June 1940 and August 1941. Before taking up his post as the head of the Sonnenstein Center, Schumann completed a psychiatric training course, lasting several weeks with Professor Werner Haider, the medical director of Operation T4 at Würzburg University Hospital. Shortly before Operation T4 was officially terminated, in August 1941, Schumann was appointed as an expert for a medical commission. Under the code name 14F13, this commission was instructed to select prisoners in the concentration camps who were unfit for work or considered incurably ill. After the operation began in April 1941, a panel of doctors began visiting concentration camps to select sick and incapacitated prisoners for elimination. To speed up the process, camp commandants made a preliminary selection list. Names of deadweight prisoners were to be compiled and presented to the medical doctors for the so-called withdrawal from service, which included any prisoner who had been unable to work for a long time or was substantially incapacitated and would not be able to return to work. Prisoners being considered for the preliminary selection were sometimes encouraged by the camp administration to come forward if they felt sick or unable to work. They were led to believe they would go to a recovery camp where they would have light duties. Many prisoners believed the lie and readily volunteered, but after they were gassed at the killing centers, the victims' belongings were sent back to the camp warehouse for sorting. Thus, prisoners learned the true reason for the selection, and even prisoners with serious illnesses stopped reporting to the infirmary. Schumann came to Auschwitz for the first time in the end of July 1941 and selected 575 prisoners who were taken to Sonnenstein Center for gassing. He carried out further selections in the Buchenwald, Dachau, Flossenburg, Gross-Rosen, Mauthausen, Neuengamme, and Niederhagen concentration camps. From December 1941 to April 1942, Schumann was transferred to the Eastern Front, where he was deployed to set up an emergency hospital in Minsk. His career then continued at Auschwitz, where he began to work at Block 30 within the Women's Hospital. Here, SS doctors were conducting human experiments aimed at finding an efficient method of preventing reproduction of genetically ill and racially undesirable individuals by inducing sterility. On behalf of Reichsführer SS Heinrich Himmler, a number of doctors were involved in developing and testing various methods for this purpose. For example, Professor Karl Klauberg, also at Auschwitz concentration camp, developed a method for mass sterilization without surgery. He achieved this by injecting a chemical preparation specially developed for this purpose into the fallopian tubes, causing them to become severely inflamed. This led to coalescence and thus to blockage of the ovaries. Schumann set up an X-ray station in 1942 and chose his test persons himself. These were then forcibly sterilized by being positioned repeatedly for several minutes between two X-ray machines, the rays aiming at their sexual organs. In order to find the optimum radiation dose, Schumann experimented with different radiation intensities and irradiation times. Most subjects died after great suffering or were gassed immediately because the radiation burns from which they suffered rendered them unfit for work. The parts of the body that were treated with the rays experienced severe radiation burns and suppuration. Men's testicles and women's ovaries were then surgically removed and sent to Breslau, today's Polish Wrocław, for histopathological examination. The test persons were always young, healthy, good-looking Jewish men, women and girls who looked like old people afterwards. In the end, Schumann concluded that X-ray radiation proved to be unsuitable as a quick method for mass sterilization. In his paper, On the Effect of X-rays on the Human Reproductive Organs, which he sent to Himmler in April 1944, Schumann wrote that the conventional surgical castration method was safer and quicker, and therefore he was suspending his experiments at Auschwitz. Whilst at Auschwitz, Schumann also performed typhus experiments by injecting people with blood from typhus patients, and then attempting to cure the newly infected subjects. Schumann left Auschwitz in April 1944, and was transferred to the Ravensbrück concentration camp, where he began a new round of experiments with Roma and Sinti children. He then divorced his first wife and married Josefa Pitz, the office worker he met at the Sonnenstein killing center, and this marriage produced 3 children. In January 1945, he was sent to the Western Front as a troop doctor, where he was captured by the Americans, but was released in October 1945. In 1946, he moved with his wife to Gladbeck, West Germany. He first worked as a sports doctor, and in 1949, he opened his own medical practice. When he applied for a gun license in 1951, his past was revealed, and a warrant was issued for his arrest. Due to the slow investigation, however, Schumann managed to escape abroad in February 1951. After 3 years as a ship's doctor, the German authorities first received information about Schumann again in February 1954 from the German consulate in Osaka, Japan, where he applied for a passport. In 1955, Schumann traveled to Egypt and subsequently to Sudan, where he worked as a head of a hospital. Whilst there, he reunited with his wife, but in 1962 was forced to flee from Sudan after being recognized by an Auschwitz survivor. Then he went via Nigeria to Ghana, where he ran a jungle hospital in the eastern part of the country. In 1961, he was stripped of his academic degree in Germany, and in 1962, he was discovered by a reporter from the Daily Express. West Germany issued an extradition request, but it was ignored by Ghanaian President Kwame Nkrumah, who considered Schumann one of his friends. In February 1966, however, the Ghanaian president was overthrown, and the new government arrested Schumann and subsequently extradited him to West Germany in November of the same year. In 1969, he divorced his second wife, who had already returned to Germany from Africa in 1965. The trial against Schumann was opened in Frankfurt in September 1970, and he was charged with killing 30,000 Jews. Schumann admitted to killing as many as 80,000 Jews, but added, "I have no numbers." The proceedings were temporarily stopped in April 1971 due to his inability to stand trial as a result of high blood pressure. In July of the following year, Horst Schumann was released from prison due to his heart condition and generally deteriorating health. In the end, Schumann never paid for his crimes. When he died in Frankfurt, West Germany, on the 5th of May 1983, he was 77 years old. There were no tears shed for Horst Schumann. Thanks for watching the World History Channel. Be sure to like and subscribe, and click the bell notification icon so you don't miss our next episodes. We thank you, and we'll see you next time on the channel.